Today, high school and college sports were a lot of fun for our next guest, but it took such a toll on her body. A doctor said she needed a knee replacement at the age of 35. Carol Gainey thought she was too young for that, but the pain got worse and worse over the years. Carol joins us this morning to fill in the rest of the story and how she got the relief she always wanted, not from surgery, but from stem cell therapy at NeoGenix. And Carol, when you heard the words knee replacement, what did you think?
Scary. I think it was going to be scary. I thought I was too young. And at that time, I don't think knee replacement surgery was as well, versed as it is now. And I just wanted to chance it.
Mm-hmm. The pain in your knee continued to get worse. How bad was it for you?
Like in the last 10 years, I've got bone on bone. When this first started, I did not have bone on bone. So I really can't tell you when I got bone on bone. But it restricted me from walking up and down steps. I couldn't bend my knee. I couldn't get out of, you'd have to hold your knee to get it in and out. I mean, I did anything I wanted to. I didn't let it keep me from doing that. Mm-hmm. But, I had knee braces and, it was just, and about 3 months ago, I had 3 weeks of not sleeping. And that's when I decided it was time to take my chances at something.
A girl's got to get her 8 hours. I understand that.
You're not kidding.
I understand that.
Sleep is required.
I get it. So someone referred to you to NeoGenix and Dr. Altizer.
Right.
You learned about stem cell therapy and their 5-step treatment process to become pain-free.
Right.
What made you willing to want to give that a try?
Well, I got on the internet and did my research, and I was very impressed with Dr. Altizer's biography, and I just decided that I would go for a consultation. And I'm telling you guys, once I got there, he is he's very thorough. He made you feel at home. He didn't pressure you. He just told you, here's what it is, and here's what we need to do. And these folks are just awesome. Mm-hmm. They really are.
Dr. James Altizer is the medical director at NeoGenix. And let's start, Dr. A, with stem cell therapy. Tell our viewers what it is and how it works.
Well, up until now, all the therapies we've had for arthritis just cover up the pain. But stem cells are the first treatment we've ever had that can actually slow down the progression of arthritis and heal the tissue damage caused by wear and tear inside of a joint.
So you've developed something called a 5-step treatment plan. Can you tell us about that?
Sure. This is what I came up with after treating thousands of patients over 5 years. The first step is preparing the joint, which calms down the inflammation and actually makes the joint more hospitable for the stem cells to work. The second step is the actual stem cell injection themselves, and we get the stem cells from each patient themselves. Mm-hmm. Step 3 is bracing the joint, especially for an arthritic knee. It's important to provide a knee brace to help the knee joint work more efficiently and work properly. Along those same lines, we always recommend physical therapy along with stem cells, because studies show that when you combine physical therapy with stem cells, you get a better result. Mm-hmm. And the 5th step is a booster shot of growth factors done into the joint 6 weeks after the stem cells, and that just kind of boosts the stem cells and makes them work even better.
So you mentioned for folks with arthritis, this is a great option. Are there other conditions that this can treat?
Absolutely. Of course, we're seeing arthritis in younger and younger people. Large joints, knees, hips, shoulders, ankles. You can do elbows, golfer's elbow, tennis elbow, plantar fasciitis, heel spurs. Partial rotator cuff tears do very well with stem cells. And there's a large population of people out there who have rotator cuff strains and tears who are looking at having surgery, and this is a great non-surgical option for those folks.
Okay, so after 6 weeks of treatment, how are you feeling today?
100%. Yes. Now, you got to realize that I had to do physical therapy, but I just can't believe it. It was just, it's just awesome.
Oh, it's so great.
Yeah.
So what can you do now that you couldn't do before when the pain was so bad?
Well, I can walk up and down steps. I can bend my knee to walk up and down steps. I can get in and out of my vehicle. I'm not in pain.
Mm-hmm.
That's the most important thing. ibuprofen, all that burns your stomach up. So, I was thankful not to have to take that anymore. So I'm not taking any medicine anymore.
So, Carol, what would you say to someone who's watching this right now? They're sitting there at home and they're in pain. What would you say to that person?
I would say that you don't have anything to lose by going to see Dr. Altizer and his staff at NeoGenix. They are a 24/7 group. I'm not kidding you. I have texted them or called them at night, and they have called me back. They're so caring. They treat you as an individual. But the most important thing is, if he can't help you, he will tell you. And to me, that was one of the winning things.
Well, listen to this. You can call NeoGenix for a free consultation to see if you're a good candidate for stem cell therapy. The consultation can be virtual or it can be in the office. The number to call is 704-727-6551. Again, 704-727-6551. You can also log on to neogenixstemcells.com.